Mark, we talk about lifespan of implants and reasons to remove them. What surgical options are there for patients who have concerns about their implants or need to have them removed?
There typically will be a range of options to our patients, and one option that is nearly always available is removing the implants, and whether or not we remove the capsule, the scar tissue around the implant at the same time, will very much depend on the situation. And if we're removing the implants, we can think about whether or not we're replacing with new implants. We might take fat from another part of the body to use instead of an implant to provide some volume. We might do a breast lift at the same time, or actually sometimes we can combine some of those procedures to get the optimal outcome for that particular patient.
If the patient was in their, say 70s, would you consider replacing an implant or would you advise them against it?
That's a great question, and I learned my lesson very well from a patient of mine about 10 years ago who was in her mid-70s in exactly that situation. I learned that my presumption that she would just want the implants out was totally wrong, and all her initial emotional and psychological concerns that led her to have the implants in the first place 44 years previously came flooding back when I brought that up in the consultation, and I learned that it's very individual and age is not prohibitive, and in her case, we replaced the implants and she was delighted.
Health over age when it comes and patient wishes.